I'm Ivy Hill. I'm our Director of Gender Justice for the Campaign for Southern Equality. Together with our partners nationwide, we lead the Trans Youth Emergency Project, which helps families of transgender youth navigate access to gender-affirming healthcare. We're hosting this town hall because we know that the landscape for trans youth healthcare access is shifting in real time for some families, as some providers, even in what we call access states, are closing their doors. For our team at the Campaign for Southern Equality, it has truly been the honor of a lifetime to stand with families and help them navigate this incredibly cruel and difficult crisis around accessing healthcare over the past few years. No one should be banned from accessing health care that they need and deserve, and no politician should insert themselves in between doctors, patients, and families. The care that is recommended and deemed necessary by every leading healthcare organization is essential, and you deserve access to it. And our team is here to help support you in navigating this climate that we're in. Our ethos is that when the government moves to restrict access to gender affirming care for transgender young people, we will move to support families. We will help them identify safe pathways to care, and then we'll provide them with the resources they need to walk that path. This summer, we saw another one of those moments. The Supreme Court upheld these bans on care, and in the wake of that decision, the Department of Justice just sent out subpoenas to hospitals and clinics trying to intimidate them into stopping care for transgender young people. Unfortunately, in some cases, the intimidation is working. And we've seen nearly 24 clinics announce that they'll stop providing gender affirming care for transgender youth, even though state and federal laws do not require them to do so. So we're here to reiterate that we're here to help alongside our partner organizations across the country, many of whom I see on this call tonight. And I can't thank you all enough for all of your incredible work and your incredible support. I know this is an extremely hard time, but please know that we are here with you. You have options and you do not have to do this alone. We will continue to innovate to help you see those options. And at this time, I would love to turn things over to David Brown, who is an attorney and expert in transgender legal issues. And we're delighted to work with at CSE to share a little bit more about this current legal landscape that we're in.
Howdy, y'all. Thanks, Ivy, for that table setting. I'm David Brown. I'm a lawyer. I have a practice that I've started full-time representing healthcare professionals who care for transgender patients in this challenging time. And I'm going to do a little bit of a legal landscape overview, helping to explain why clinics are closing, why they shouldn't be closing, and what folks can do about clinic closures. Before I get started, I have to say the standard disclaimer, which is that although I'm a lawyer, I'm not your lawyer. So everything that I say today is not to be taken as legal advice. If you have a specific legal question, you should ask an attorney who represents you. I'm just providing education about the law. And I believe I can't control slides, so I'll say next slide. Thank you. All right. So first of all, where are we in this current moment? So since 2022, couple of dozen states have passed state-level restrictions on gender-affirming care, trans healthcare for young people, generally under the age of 18 or sometimes 19. And then earlier this summer, the Supreme Court upheld Tennessee's restrictions on gender-affirming care for youth in a case called Skirmety that y'all might have heard of. But there's two pieces of good news. The first one is that Bostock, a case that the Supreme Court decided in 2020, state laws and other resources are still on the books that give lawyers opportunities to fight back against some of these cruel bans and anti-transgender policies. And even more important, next slide, please. Thank you. Trans healthcare is still legal under federal law. There is no federal law that bans trans healthcare for young people, for people of any age. Next slide, please. So why are clinics closing? Well, in states that have youth care bans, some of them have been reducing services for youth because of compliance with state law, and that's to be expected. But we're seeing a lot of clinics close even in access states. And the reasons for that are the three that I've put up here. So one is just overcompliance, right? So people know that the Trump administration put out a bunch of executive orders about trans healthcare that said a lot of crazy things. Those executive orders are not the law. A president cannot change a law by executive order. Only Congress can change the law. So a lot of people misunderstood what the president was doing in putting out essentially these like fancy, I don't know, what would you call them? Statements of policy preference, or basically press releases, gussied up, right? About the things that he would like to do, and people thought these were things that he'd actually done, which is false. People also misunderstood that there are some bills moving through Congress, or moving in Congress, I should say, that might impose restrictions on gender-affirming care in various ways. But none of those bills have passed. And until they do, they're just not the law. And also, those bills would impose, if they become law, different kinds of restrictions. And some people think they're a lot more restrictive than they are. So, for example, a bill that would limit, say, Medicaid from providing coverage for care doesn't prohibit people from getting it outside of Medicaid, doesn't prohibit doctors from providing it outside of Medicaid. People often confuse the message around what bills might do if they ever get enacted, and so they think things are being restricted when they're actually not. So at this point, once again, there is no federal law that restricts the provision of gender-affirming care, period, full stop. People also get a little bit confused about the Skermeti case. What the Skermeti case did was the Supreme Court upheld Tennessee's restriction on youth care against an argument that it violated the Equal Protection Clause. That's it. So it just simply said, Tennessee's ban is not unconstitutional in this particular way. It didn't uphold any other bans, although by extension, some other cases, some other challenges had to be ended against bans, but it didn't say anything about care being illegal. It didn't say it's prohibited under federal law. It didn't do anything more than say Tennessee's ban is constitutional in this particular way. So it didn't put any new restrictions on gender-affirming care. I think the main reason that clinics are closing in access states right now is that they're just folding like a cheap suit, which is a technical legal term. I think Ivy said fear, right? That's another word for it, right? Lack of courage. So the federal government has put out a few subpoenas asking clinics to talk to them about the kind of care that they provide. And that has frightened some providers into stopping providing care. The federal government has also threatened funding through federal programs like Medicaid, for example, or research grants for providers of gender-affirming care. But because the president by himself can't change laws that provide that funding, all of those threats have thus far, I'll talk about this more in a second, but have thus far not been able to be implemented. Right? They're just threats, basically. But those have been enough for clinics to close. And so there's a big kind of over-compliance problem where people don't stand up for the rights that they actually have, but instead give in to fear and stop providing. Next slide, please. So how are we fighting back? How are we standing up for rights? Well, first of all, I mentioned litigation, right? So the executive orders that have threatened funding, people have brought lawsuits against to say, because the president can't change the law through an executive order, any attempts to cut funding for research, for Medicaid coverage, for whatever, are illegal, right? It would take an act of Congress to do these things. And thus far, those lawsuits have gotten a lot of those efforts blocked. The courageous folks at PFLAG, at GLAMA, which used to be the Gay and Lesbian Medical Association, and others have brought cases that are still underway. They haven't won yet, but thus far have been successful, at least in drawing the line through getting things like preliminary injunctions. So if you're not a member of PFLAG, if you're not a member of GLAMA, I would highly recommend joining because that enables you to benefit from some of the protections that they can get by bringing these lawsuits. They're great resources for information about them. They're great partners to have in your court. I think I mangled that metaphor, but they're good people to get to know and become a part of. There are also state court litigation challenging bans and closures. So, for example, even though Skermeti said, well, Tennessee's ban doesn't violate the federal Equal Protection Clause, there's the Wrigley case in North Dakota, the Cross case in Montana, where state Supreme Courts are stepping in and saying, I don't care what the federal Supreme Court has to say. We in Montana have rights. We in North Dakota have rights. And bans are unconstitutional under our state constitutions. So you're going to be seeing hopefully more of those in states, especially more kind of traditionally libertarian leaning, traditionally sort of like Western states often have constitutions that protect individual liberties. And so, courageous trans individuals and healthcare providers are standing up and bringing in winning cases in those states. UPMC in Pittsburgh was also recently challenged in an administrative action there when they stopped providing care by people who say that that violates Pennsylvania law. So clinics who fold like a cheap suit might find themselves getting sued under state law by courageous trans families. And then some of the recipients of subpoenas, like Boston Children's Hospital, for example, have stood up and said, we're not going to answer these abusive legal processes. We need to protect our rights and protect our patients' rights, and we're not going to respond to these subpoenas. And they've been winning these lawsuits thus far. So these are three really bright spots, kinds of bright spots that we're seeing more of. Next slide, please. Yes, CHOP is suing also, someone said in the comment. I haven't seen the results of that yet, but they're bringing a suit, and that's great, against the subpoena they received. So what can people do? And I know I'm running out of time here, so I'll try to be as fast as possible. If you are worried about your provider either folding like a cheap suit or getting attacked by the federal government, here's a few items that you can put in your own pocket. And I should have added, first of all, join GLAMA, join PFLAG. I forgot to put it on this slide as well. But thank providers who are standing strong. If your provider hasn't given in, if they're still providing care, send them a note. Say thank you. Send their institution a note. Say thank you. People always like it when their boss hears praise about them. If your provider has closed and you're worried about the privacy of you or your kids' medical records, send them a note that reminds them that under HIPAA, they are required to notify you before handing any records over to the feds. That can be a useful reminder for some folks. And you may remember, for example, Vanderbilt Hospital in Tennessee handed some records over a couple of years ago in response to an inquiry, and they're in a lot of hot water. They're being sued by families right now over their failure to do that. So it's an important right that you have. Keep engaged with state officials, state legislators, state attorneys general are a great resource. A number of them have started working to protect their state residents' rights in Massachusetts, in New York, in California. Be mindful if you contact your state attorney general that they aren't forever. If you're providing information to them, you're also providing information to their office, which means if the office holder changes and becomes somebody who is anti-trans healthcare, they'll have that information. So be mindful of that. But it can be a good idea to talk to them, especially over the phone. Similarly, you can file a complaint yourself if you want through your state's regulator, their attorney general's office, their healthcare regulator. Make it clear in your complaint if your provider's institution is the source of the problem, that it's them and not the provider. Finally, you can work with lawyers and help desks. And I want to say that's within limits in two ways. Lawyers aren't cheap, right? If you want to hire a lawyer to protect your rights, that is absolutely right, and you should do so. Look for a malpractice attorney. Those are typically the ones who are most versed in things like privacy claims. You can also look for a discrimination attorney who specializes in healthcare. But just be mindful that that's doesn't come for free. You can also reach out to the help desks at national LGBT and trans organizations. GLAAD, Transgender Law Center, and NCLR have help desks, Lando Legal also. And let them know what your issue is. But just keep in mind that those organizations are focused on helping the nation and the community as a whole. They may or may not be able to ever address your specific problem, but know that they're still working on it behind the scenes, even if they can't, right? They're getting hundreds, thousands of inquiries around the country and figuring out the best way to address them collectively. With that, I think, next slide. Yeah, I want to thank you for joining us today, and I will hand it over to Van and Sherry.
Good evening, everyone. My name is Dr. Van Bailey, and I use they, them, theirs pronouns. I'm the Family Resources Manager here at Campaign for Southern Equality, as well as I'm on the patient navigation team. And so I would be one of the folks that you would talk to should you utilize the service of the Trans Youth Emergency Project, or tie-up as we like to call it. We know that this is a challenging time, and that's really why Tie Up is here to help. And we really want to thank all of our amazing state and local partners who've been doing the amazing work to support families to get the word out about this project. So, a little bit about what Tie Up is. It's several different things. The first thing is patient navigation. That's where we provide, navigation to unimpacted providers. And we also do that through tailored one-on-one calls, right? So it is something that you do have to get on a call with us, and we will meet those needs on a one-on-one basis. The second thing is we provide travel grants for families and states with bans. So that is $500 for a travel cost and a renewable every 3 months. And then for families in access states and things like that, needing to really relocate to clinic closure, that's a one-time $500 grant. And then we also try to provide a place to return to when you have questions or interruptions. So we do not see this as a one and done. Should you have additional questions or you need additional navigation services, definitely feel free to reach out to us. And then we also provide connection to free flights through our partner, Elevated Access. And then we also have wraparound support through our programs and things like that. And so Tie Up is a full-fledged program, and we see you all as a part of our community, and it's always going to be a touch point for you all to return back to should you need support. I'm going to turn it over to Sherry to go a little bit more in depth about what the process looks like. And I just want to thank Sherry and to take us on this journey.
Hi, I'm Sherry Keller. I'm the Community Resources Manager at CSC, and I'm a patient navigator. I see folks on this call that I have spoken to before. So I just want to walk you through the process a little bit about what happens so you can get a little more familiar with it. First, you would go to our website and fill out the intake form. That's just going to ask you some basic questions. And what that does is allows us to know where to direct you. Then you'll be scheduling a call with one of our navigators. Several of us are on here. Van's on here, Gracie's on here, and myself. And we will hop on a one-on-one call with you, and specifically with you. So the parent or guardian, your kiddo does not need to be on the call, does not need to be anywhere near the call. We leave that completely up to you. And when you fill out the form on our website, we want your information and not your kiddos. Um, and then what we'll do is we'll talk through the options for your unique situation. So depending on what state you're in, maybe that looks like the closest clinics in the closest clinics to you, or maybe that looks like figuring out where you have family and friends. It might be an easy place for you to travel to. And so we sort of factor those things in together, and we figure out what kind of support you need in terms of clinics. And then we also work with Elevated Access, as Van stated before, and they're an amazing group, and they provide free flights with their volunteer pilots to help get you to your appointments, and return back from your appointments. And that would also be for you and your kiddo, and that's done on these calls. And then also, we'll talk about the travel grants on the call and take your payment information. Normally, that's like PayPal, Venmo, or a check. And you will receive that within 2 weeks. That's processed electronically. And then we will be in touch about every 3 months. It's a week before every 3 months is about when we send an email out to you asking if you would like another grant with us. And we're happy to support you and provide them and hop on any call again to re-go over any of this information. So that's what our calls look like. And then for families who live in states that don't have a statewide ban but have experienced clinic closures, so they have to relocate care, we can help you identify another provider in your state or nearby, and we have some good options around that generally. And then we can also provide a one-time relocation grant of $500. And when I say relocation, it's relocation of care. It's because we want you to be able to continue that care and make it as easy on you as possible. Since launching this project, we have helped 1,500 families of trans youth across 27 states. And above all, we know this is really, really tough. Um, all of y'all, your families build close relationships with providers, and some families have had to relocate care multiple times, and we really feel for you, and we know it's not easy, and we really want to support you through this process in whatever way that we can. So if we have to hop on the phone with you over and over again, obviously that's not ideal for y'all, but we're happy to do that as many times as you need. Um, we know that accessing care is possible, and that's the thing that we have to hold on to right now, that is that it's still possible. Um, it will be more expensive. It will be logistically challenging, but we're here to help you every step of the way. And we know our team is here and ready to support you, and we want to continue to do that in any way that we can. And I will throw it back over to Van.
Yeah, absolutely. So we want to just give you all a little bit more information because we know that navigation services is only one part of you all's journey, and we understand that support is necessary, all around. And so we have some wraparound support services that are in play right now. One of which is our support group for families of trans youth. These are the dates that are up right now. For the rest of the year. So please take note of those. And if you would like to sign up, it's right at the bottom in terms of this website, southernequality.org/ tie-up parent support. And then the other thing that we have is we want you all to subscribe to our Trans Cookout podcast series. You're welcome to sign up there and hear more about the amazing work that's happening across the country in regards providing support to trans youth, and listen to some leaders and folks from across the country talk about that as well. We also want to encourage you to find local or state LGBTQ advocacy organizations to get involved in. Just so you all know that legislative sessions are happening soon. So there is no way to better kind of counteract feelings than action as it relates to community. And so, we want to encourage you all to stay connected to us, stay connected to the parent support group, listen to our podcasts, and also, we want to give you a little bit more information about our amazing supportive schools program. So I'm going to turn that over to Craig to lead us in more information about that. Thank you all so much.
Great, Van. Thank you so much. My name is Craig White. I'm the Supportive Schools Director for the Campaign for Southern Equality. We realize that folks have other challenges in their life besides access to gender affirming care, and discrimination in schools is one of those. If you could go to the next slide, please. So the Supportive Schools program has four main threads. One is we support the local organizing of student, parent, and teacher groups that are advocating for LGBTQ inclusive schools. We also provide a certain amount of direct support to families of LGBTQ students who are experiencing discrimination, harassment, or other issues at school. We also work with teachers and provide guidance to school administrations and school boards. We share that policy with schools. Things are a little confusing right now, as in the area of gender affirming care, there's a lot of misunderstanding about what the law actually says and doesn't say. We see a lot of overcompliance of the similar type that David talked about in the school setting. And so one of our roles also is to challenge those anti-LGBTQ policies that are coming out, whether that's at the district level, the state level, or the federal level. I will point out, if you are not already on CSE's email list, we'll be launching a campaign this fall called Mirrors and Windows, where we are going after book bans and censorship in the curriculum, really believing that people of color and LGBTQ people need to be represented in the school curriculum. Every student has a right to see themselves and their family reflected in the curriculum so they know that they belong at school. and every student has a right to see and learn about families that are different than their own. When it comes to the discrimination that families are facing, we're seeing some general patterns this year, and I'll pass it over to my colleague Gracie to talk about those.
Thanks, Craig, and thanks everyone for being here. My name is Gracie Taylor. I use they, them pronouns, and I'm the Supportive Schools Coordinator with CSC and also a patient navigator, as Sherry mentioned. Some of the common concerns that we do see among those reaching out to supportive schools are concerns around using the correct names and pronouns, specifically within programs like Power School, and having teachers use those correct names and pronouns, as well as using the restrooms and facilities that they feel comfortable using, privacy and outing policies, bullying, harassment related to sexuality or gender, being able to participate in school athletics that are competitive rather than going and outsourcing sports and field trips, mainly overnight stays, curriculum review, and the list goes on, unfortunately. If you, as an educator or a parent or your kiddo is going through something similar to this or completely different and feel like we could offer any support, I will go ahead and put our email in the chat. That'll go to both Craig and I will pass it on to Ivy for some action steps for families.
Oh, thank you so much. And I know we have talked a lot about the Trans Youth Emergency Project and, that all of us who are on the call are part of that team, but I also just really can't say enough about the Supportive Schools program and how impactful those resources have been just for me and my family. And I know a lot of other folks in the community too. So if you need that support, please reach out. They're incredible folks, really doing incredible work. And I just feel so grateful to get to work with this team. That's not what I'm supposed to be talking about right now, though. I'm supposed to be talking about action steps for families. So the most important thing that you can do right now is really just to talk to your provider. Ask if they're impacted by anti-transgender restrictions. There's just nothing like having that one-on-one connection and conversation with your provider. If they're not, we recommend taking things one day at a time. And I know that that's unsettling and that this is like horrible, difficult times that we're walking through right now. But the name of the game here is really just one foot in front of the other. As long as you can access care where you are, that's great. And we can take advantage of that. And we will be here if that changes. You can write into the Trans Youth Emergency Project also to better understand backup plans in case something happens with your current provider and you want to have another plan in place. That's something that our patient navigation team would be happy to help you figure out as well. You can ask your current provider about backup plans too. They may have some additional resources and it would never hurt to ask that question. And if you are impacted and your provider ever cancels your appointment, please contact Tie Up for support. We can share providers who are not impacted by these restrictions. We can help answer questions. We can move funding to you to help pay the additional costs of initiating new care, travel, medicine, and all of that stuff as well. Additional things that families can do right now. You can thank and support local providers who are not shutting down. That's huge. And it takes a lot when they're getting these letters of intimidation and stuff to not give in and say, no, we're going to continue to provide care here. So I think a thank you can go a long way there. Also get involved locally with state orgs and support groups. I know this program is national now, even though we started out much smaller. But there are also lots of really incredible state and local organizations, and that's something that is really important to us, is to make sure that we're partnering with those folks too, who are on the ground where you are. Another thing you could do is host a fundraiser for Tie Up if you want to get involved and support that way. That's always something that we would welcome. At this point, we're going to shift into question and answer. So I think we're going to go ahead and stop recording here.